Hi everyone, welcome to my Web of Causation. For this project, I decided to focus on breast cancer among Hispanic women. So before we start talking about some of the causes and determinants, let's first take a look at what breast cancer is. According to the American Cancer Society, breast cancer is a malignant tumor that starts in the cells of the breast. A malignant tumor is a group of cancer cells that grow into surrounding tissues and can spread to other areas of the body. Breast cancer mainly occurs in women, but men can also be affected by the disease. So for this slide, we're going to talk about some of the signs and symptoms of breast cancer. And before I talk about these, I just wanted to point out that some of the research also has stated that you don't have to experience any of these symptoms to have breast cancer. Sometimes women who get the disease don't experience any of these symptoms, so that is one thing to point out. But a general consensus among the research said that some of the signs and symptoms to look out for include change in how the nipple feels, including tenderness, lumps, or thickening of the skin, change in appearance of the breast or nipple discharge that's not associated with breastfeeding, and swelling in surrounding areas and pain and tenderness in the breast. So now that we've looked at some of the symptoms of the disease, let's take a look at the breast cancer diagnosis process. So if there is concern, typically you will see your provider, and during this physical exam, you're going to probably explore your medical history, family history, and things of that nature to understand the prevalence of the disease within your family. Your provider will then suggest testing, and whether that's a mammogram or different imaging testing. Typically it is a mammogram, and then another step in the process would typically be a biopsy where they will remove and extract different cells and tissues from the body and that area to test them for cancer. So we're going to take a look at the prevalence of breast cancer among the general population, and the National Cancer Institute predicts that in 2014 there will be over 230,000 new cases. Breast cancer represents 14% of all new cancer cases in the United States alone, and approximately 12.3% of women will be diagnosed with breast cancer at some point in their lifetime. So now we're going to take a look at the prevalence in Hispanics. This graphic that I want to point your attention to is provided by the National Cancer Institute, and this is the number of new cases per 100,000 people based on their race and ethnicity. And as you can see, Hispanics have a lower rate than white, black, Asian Pacific Islander, and non-Hispanic populations. One of the things that I want to point out is that even though that it occurs at such a lower incidence, breast cancer is the leading cause of death in Hispanic women, and that when breast cancer is caught in Hispanic women, it's usually at a later stage when treatment is less effective. So while it occurs at a lower prevalence than the general population, it's still a very serious disease for the community. So this first article looks at the link between obesity, diabetes, and genetic predisposition in breast cancer, specifically among the Hispanic population. The study noted that obesity causes and exacerbates certain diseases, including breast cancer, and that excessive weight can play a role in breast cancer-related deaths, among cancer-related deaths as well. The study noted that socioeconomic conditions also play a role in breast cancer rates, obesity rates, and incidences of diabetes. And that's due to things like lack of access to grocery stores, poorer food choices due to budget restrictions, and lack of access to fresh foods. So for this slide, we're going to look at nativity and neighborhoods. And I thought this study was very interesting because it compared foreign-born Hispanic women and their U.S. counterparts. And it was trying to explore the neighborhood and environment in relation to breast cancer diagnosis and the stage. So there was over 37,000 participants from California studied between 1988 and 2005. And what researchers concluded was that living in a low socioeconomic neighborhood was associated with a later stage of diagnosis, and that Hispanic immigrants had a better rate of survival than their counterparts. In this article, we look at the characteristics of mammogram screenings. And what the article found was that Hispanic women are significantly less likely to receive mammogram screenings. And factors that contribute to this include their low socioeconomic status, health access barriers, things like lack of quality care, lack of health insurance, and cultural barriers. The study also noted that Hispanic women are less likely to adhere to screening guidelines in comparison to their counterparts. Again, factors that influence that include the lack of education about screenings and diseases, and then also language barriers and a lack of materials in their native language. In this article, they compared neighborhood socioeconomic disadvantages both at the self and community level to explore those determinants. What researchers found was that women who have lower education, lower income levels, and who are underinsured or uninsured are less likely to be screened and more likely to be diagnosed at a later stage of the disease. Of course, the stage of diagnosis is critical to survival, treatment, and outcomes. What they found was that Hispanic women had higher rates of breast cancer diagnosis at later stages and showed the least improvement. Researchers recommended interventions focusing on accessing health services, education of the community, including translating materials, and offering classes on providing information on screening and resources. So this study looked at the link between nutrition and breast cancer, and what researchers found after working with breast cancer patients between 25 and 79 in the states of Arizona, Colorado, New Mexico, and Utah were that diets that were high in carbohydrates were linked to an increased risk of breast cancer. A Western diet was also associated with factors such as obesity and an increased risk. So for this study, researchers in Texas were really focusing on the incidence of breast cancer in Hispanics. And the reason why they wanted to explore that is because breast cancer is the leading cause of cancer mortality in women living within that region. And 81.4% of the population of that region is Hispanic or Latino. They are also affected by high poverty levels and low education levels. The study noted that incidence of breast cancer increased by 13% among Hispanics during that time, and that overall the association between Hispanic ethnicity and being diagnosed at a later stage was relatively high. This article explores closely the role of obesity and how that factors into breast cancer prior to treatment and after treatment. The New Mexico Women's Health Study used over 400 Hispanic cases and over 400 non-Hispanic white cases. Over the course of the study, which was 13 years, there were over 200 deaths. Researchers found that obesity can impact quality of life and that being obese at time of diagnosis is associated with poorer survival rates and an increased likelihood of recurrence of breast cancer. So this study really focused on Latinas and breast cancer, and researchers used patient data between 1992 and 2000. Patients were followed 5 to 11 years after diagnosis, and in total, patient data was collected for over 44,000 women. Researchers found that Latina breast cancer patients are 20% more likely to die within 5 years after diagnosis compared to white women. The study noted that in the United States, 16.7% of the population is Latino, and that represents over 52 million citizens. Researchers also explained that Latina women use less routine physician screenings, including mammograms, and that's another significant factor in why they are diagnosed at a later stage and typically are older at diagnosis. So after reviewing the literature, this is the web of causation that I created. And so we're just going to look at each one of these determinants individually. The first one is obesity, and then under that it reads poor nutrition. The second determinant would be their socioeconomic status. Usually lower incomes are affected. The third determinant is the neighborhood, their actual environmental surroundings. The fourth one, education, and that is a general lack of education, and with that, a lack of education about screening and the disease. The fifth determinant is family history. Genetics plays a huge role in breast cancer and breast cancer outcomes. The sixth determinant is cultural barriers. A lot of times in the Hispanic community, if they don't speak English, there's major language barriers to accessing resources, services, and things of that nature. The seventh determinant kind of ties into the cultural barriers, socioeconomic status, education, and things of that nature, but that's a lack of access to quality health care, a lack of screenings, a lack of coverage, and those all play into later diagnoses. And the last determinant is individual age, typically because they're diagnosed at later ages. That definitely plays a role in recovery and things of that nature. So age of diagnosis is also a critical component. So taking a look at the social work perspective, this article looked to see if community-based participatory research and to measure whether or not community-engaged research would help reduce health disparities. And they focused on African American and white disparities in breast cancer in Chicago. And the study had a 5-year program that involved community members, and they had all sorts of programs. And each year they focused on a different program. One year they focused on focus groups, the next it was community advisory and community collaboration, and so on. And so they did all of these different components, and that what researchers ended up finding was that community-based participatory research has the potential to decrease health disparities, and that it improves health outcomes for racial and ethnic groups, ensuring research from others is informed by community values and cultures, and develops interventions that are community and culturally appropriate. So some of the implications that it leaves for social work and that we need to be responsive to communities and make sure that communities that are affected by certain diseases make sure that they have, materials that they understand, interventions that they understand, and just making sure that the community is aware and using that community perspective. We're going to take a look at a community program that's local to us in Atlanta. It's the Cancer Support Community Atlanta. They're affiliate of Northside Hospital Cancer Institute, and they're a nonprofit providing supportive services for cancer patients and their families. And they have different services, and they range from support services, things like support groups, to education about the disease, treatment, things of that nature, healthy lifestyle classes, and social activities to connect the different patients among the community and the community with the patients, and just building that network of supports. Cancer Support Community Atlanta works to enhance patient well-being, and some of their goals are to provide cancer patients and their families with comprehensive education and knowledge, to equip and empower patients and families to make decisions regarding their care. Now, Cancer Support Atlanta has not itself been tested for effectiveness, but we can see that since their establishment in 1997, thousands of women have received services. They have over 50 local affiliates and more than 100 satellite locations, and research shows that support services like this are effective for cancer. So for this slide, we're going to focus on some of the health-related policies surrounding breast cancer. And one of the things while doing research that I came across was the National Breast Cancer Coalition. And they have different public policy acts that they're working on as an organization, but one of their main focuses is the Accelerating the End of Breast Cancer Act that was initiated in 2010. Their target population is women nationwide, and their goals are to end breast cancer by engaging stakeholders, policymakers, researchers, and advocates to concentrate their efforts to finding an end to the disease by the year 2020. Intended to shift focus on the disease by identifying strategies for prevention and understanding and preventing metastasis, which is the spreading of the disease. A lot of the policies that are in place focus on treatment rather than prevention. In the last 40 years, little has changed on incidence and morbidity of breast cancer rates, yet we've come so far with policies and technological advances. Now, the Accelerating the End of Breast Cancer Act has not been tested for effectiveness because the act is still an act. It's not a policy yet. So I would be curious to see, once the act does become a policy, what that would look like and how effective that would be once it's in legislation. I hope that you guys have learned a lot through this web of causation. Some of the points that I would like for you to take home are that breast cancer is a very serious disease. It makes up 14% of new cancer cases in the United States. Hispanic women tend to be diagnosed at a later stage, and thus treatment is less effective. Breast cancer is the leading cause of cancer death for Hispanic women. And lastly, Latina breast cancer patients are 20% more likely to die within the first 5 years of diagnosis. Thank you for your time, and I hope you've learned a lot.